Before your first use, you'll want to hand wash it in warm water with a mild soap. The knob and springs are made of surgical-grade stainless steel, which means that in addition to being completely safe to use inside your body, they won't rust or corrode. The first step is to add springs to match your current level of resistance. So, just open the unit, place a spring on the first post, match it up with the other side, and close the Kegelmaster. Screw the knob on so the two sides are touching. That means the Kegelmaster is in the closed position. Find a position that's comfortable for you. Most women like to lie on their backs with their knees bent and their feet flat, about 2 feet apart. Lubrication is a crucial step because it makes insertion and removal easier. You'll need a water-soluble, not an oil-based lubricant. Lubricate the vaginal area and the first 3 inches of the Kegelmaster, from the tip to what we call the flare. You're never going to insert the unit more than is comfortable for you, and never past the flare. Be sure that the unit is completely closed, and then insert it, knob side up, into your vaginal opening until it's firmly in place. It's designed to stop automatically at the flare. Now, at this point, some women feel the natural urge to do an abdominal push, but this isn't a Kegel exercise. In fact, it can even cause the Kegelmaster to slip out. So, to prevent this, use your hand to hold the unit in place until you are comfortable doing proper Kegel contractions. The motion you'll want is a squeeze, not a push. With the Kegelmaster inserted and the knob loosened to allow for resistance, you're ready to begin your exercise program. Try using your vaginal muscles to squeeze the Kegelmaster closed. Focus only on using your vaginal muscles, not your abdominals or gluteal muscles. Count to 2 and release. If you're able to move the Kegelmaster, you're on the right setting and you're doing the right exercises. But if you aren't getting movement, you need to try reducing or increasing your resistance until you feel slight pressure against the vaginal opening. Remember, you don't want to try too many springs at first. The idea is to get as much movement from the Kegelmaster as possible. And it doesn't have to close completely to benefit you. You can do as few or as many sets and reps as you wish, but we typically recommend 3 sets of 30 contractions. You can count 1, 1, 2, release, 2, 1, 2, release. And you can monitor the base of the Kegelmaster and feel the unit closing. When you've finished, tighten the knob by turning it clockwise until the Kegelmaster is in the closed position, and then gently twist from side to side and slowly pull straight back until the unit is removed. Remember to hand wash your Kegelmaster with a mild soap between each use, and make sure it's completely dry before you put it away for the day. Well, those are the simple steps that are going to help you get your muscles back in shape. It only takes minutes a day, but using the Kegelmaster can change your life.